So what is actually labor? Labor is when you start to have regular contraction pains that's coming every 5 to 8 minutes. And it's a progressive thing, meaning that as time goes by, you find that the intensity of the pain actually gets stronger and stronger, and the interval actually gets closer. So it's something that you can only tell with time. It's not at the very first pain or so that you know, oh, I'm in labor. So you need to give yourself that time. Now, how does a contraction feel? So a lot of women always wonder, because of course they've never gone through that, and they're always asking me, how's it like? Will I know? You will know. Okay, you'll be very lucky if you can't tell. But most women will be able to tell the pain. So it typically starts from the lower back, and then it comes down to the front. And it's usually a generalized area. That means you feel it over the whole tummy or the top of the tummy, rather than a pinpoint area. So if you can point out to me where you're feeling the pain, means that's not contraction, okay? And when the contraction comes, it's only going to last for less than a minute, and it will go off, and you'll feel quite okay in between. And then it comes back again. For discomfort that is constantly there, sometimes that's just Braxton Hicks. And of course, with Braxton Hicks, it's going to be very common. You can start feeling it actually in the second half of the pregnancy already, okay? So regular contraction pains are probably the most common thing that brings women to the hospital. Sometimes the water bag may break first. Again, it's not as dramatic as the movie suggests, okay? If it's one whole big gush, you will know, but a lot of times it can be just a trickle, and you find that it wets your panties or may trickle down your thighs. In a lot of cases, vaginal discharge can also behave similarly. So how do you tell the difference? Put on a panty liner or pad. In the next half an hour or 1 hour, if you find that the pad is all soaked, then you know for sure your water bag has broken. Then make your way to the hospital. Okay, so there's no rush. You can always observe how it goes first. What is show? Show is actually some mucousy discharge that's mixed a little bit with blood. You may actually start to see it sometimes even at 34 weeks or 30 weeks when the cervix starts to soften. If there isn't any regular contraction pains, nothing may actually happen out of it. So with show, I tend to ask patients to just observe first. Don't rush to the hospitals unless the pain starts.